Hello and welcome. Wave 2 of COVID-19 appears to be receding now in India. The number of cases as well as the deaths are coming down to the extent that we can believe the numbers. But if we were to go by the feedback that we are seeing, particularly from health and medical professionals, indeed the situation seems to be improving. Now, the question is, what is going to happen in wave 3, which is inevitable in some ways from what has happened or we've seen in other countries. And at least this time, there seems to be a sense that we should be better prepared, even if we are not actually better prepared when wave 3 hits India. So one of the questions that's coming up again and again is, are children going to be more affected? And there are some mixed signals there, particularly since there is no clear data that children are going to be affected unless we look at some countries like Brazil, which I'm going to come to in a moment. But there is some apprehension that given the fact that children have been in some way shielded all this while, and if they're likely to be exposed, then what could happen? And there is some effort underway to be physically ready, particularly in terms of hospital infrastructure and so on in some places. So in countries like Brazil, since that's one example, they've seen more than 2,200 children under the age of 10 dying from COVID-19. Now, that's a small fraction of the overall deaths. At about 470,000, but it's still high because over 900 children under the age of 5 have passed away. In the United States, which has over 600,000 deaths, the number of children under 5 is only 113. Now, this could also be driven, particularly in countries like Brazil, by variants like Gamma, which is a variant of concern and not the same one as the Delta in India. But again, brings us back to the larger question about what do we really know about variants like Delta and how they could progress into the third wave, or of course, could it become something else? So to understand where this could go, particularly in the context of children and pediatrics in wave 3, I'm joined by two experts. Dr. Amit Gupta, Director of Newborn Services from Oxford University in the UK. Dr. Gupta is an MBBS and MD from Surat in India. And he was later appointed as consultant in neonatal Medicare in Oxford in 2009 at the John Ratcliffe Hospital. He continues to work remotely in India and Sri Lanka, particularly in the area of training people. Dr. Tanu Singhal, consultant in pediatrics and infectious diseases from the Kokilaben Ambani Hospital, joins me here in Mumbai. She completed her pediatrics from the All India Institute of Medical Sciences and studied infectious diseases and international health at the London School of Hygiene and Tropical Medicine. Thank you both for joining me. Dr. Singhal, let me begin with you. How are you seeing the progression from wave 2 to wave 3, particularly as we are seeing the number of overall cases recede in most of India, including in cities like Mumbai?
So first of all, I would like to say that this prophecy that children are going to be affected more in the third wave does not really have a lot of scientific evidence behind it. It is mainly speculation, and I'll tell you why that is the speculation is that, first of all, in the first wave, we saw elderly people getting affected. Then in the second wave, we saw a lot of young adults getting affected. So we think that, as the third wave comes in, children will get more affected. That is one of the things. And also during the second wave, we saw a little bit more severe disease in children as compared to the first wave. However, at the same time, 99% of those children recovered at home. The second reason is that adults and elderly people will be well vaccinated by then, and children will not have received their vaccines, and that's why they are going to be more affected. And the third thing is that, as the second wave recedes, we'll have schools opening up, and children who have not been infected till now will go out and will get infected and have a disease in the third wave. So those are the reasons why they think that children may be more affected. But at the same time, I want to draw your attention to a sero survey which was done in January, in which they compared the seroprevalence of COVID in adults and children between the ages of 10 to 17 years, and it was same in both, about 24.7%. It means that children have got infected in the first wave, but it's just that they have not had so many symptoms. So, it's still open, and generally speaking, COVID-19 is a mild disease in children because of various biological reasons. So,
Right.
I still feel that children so as a proportion of those people who get infected, they may constitute a larger proportion, but overall, the disease should not be very severe unless we have a dramatically different variant coming into the picture.
Right, and I don't know if you've got Dr. Gupta back, but is there a sense that a different variant could behave completely differently? And I mean, is there a way that you in the medical profession can even do some amount of crystal ball gazing here, Dr. Gupta?
So all I can say is from the variants that we've had so far, you see, the variants we have had so far, none of them have extraordinarily attacked children. So that's very important. We haven't had any of the variants which have gone and attacked children in preference to adults. So I think that's very important. The illness in the children tends to be really mild, and it continues to be mild. What I was trying to get at, which I got cut at, was that there is a very small proportion of children who can get exceptionally unwell because of a immune sort of reaction to COVID, and it's called MISC. I think in the US all over, I think they have seen 800 cases of MISC, and in that case, the child can get very unwell, and they can be usually cardiac manifestations and gastrointestinal manifestations, and the recognition of that illness is very important. So that is important.
Right.
Now, let's come to what we have seen in India. Let's forget about the UK data for a moment. The data from India would support that during wave 2, when the virus was at its peak, when the infection rate was quite high, and no matter how much shielding you would do, the secondary infection rate is so high in COVID that your kids in the family would have got infected. There is no way that they wouldn't have. But we haven't seen the amount of children, we haven't seen an upsurge or an overloading of our pediatric hospitals during wave 2 in India. And that is also supported by the data that we've got from All India Institute, which confirms that actually in wave 2, we haven't seen this to that extent. Now, let's just take one step forward and let's go to wave 3. By wave 3, what you mean is either you've got a new mutant, which is causing your wave 3, or this current mutant, once you've got relaxation of restrictions, it then starts infecting more and more people. Now, on one hand, that would happen. The other hand, your vaccination numbers will go up. If the mutant doesn't change, if there is no new mutant, the expectation is in wave 3, the total number of cases will be lower because your vaccination rates would have picked up a little bit. And it is not expected that you will have a repeat of the second wave. It is unlikely. It can happen, but it's unlikely. So my premise is this, that if we weren't overloaded in the second wave, why should we fear that our pediatric hospitals will suddenly get overburdened in wave 3, which is likely to be lighter than the wave 2 by all indications, unless, of course, suddenly out of the blue, you get a mutant which then infects children in preference to adults. So
that's an important point to consider. But is there anything that we can take away, Dr. Gupta, from the UK or the Europe? Because you, of course, in the UK now are at a very advanced pace of vaccination, and you've covered a very large proportion of adult population. But if you were to go back a few months, how were things then, particularly as you moved from second to third wave?
Yeah, so the third wave hasn't happened. It's been talked about, and it's likely that at some point it might come. But the vaccination strategy for kids, it heavily relies upon vaccinating a population of children so that when they are in school, they do not circulate the virus in excess and then come home and infect the adult population. So the primary motive here is not to protect children as much as prevent the circulating virus. And I think that's a very important point to get across. It's not that suddenly people discovered that children in UK were filling up wards and we needed to have a vaccine strategy to protect the health. The primary driver there is to reduce the circulating virus. So at the moment, we've got so I'll give you an example of Israel. What happened in Israel? They did not have to vaccinate the young children because the adults reached such high levels of vaccination that the children were immune anyway, so they don't have infection in kids. So you have to look at infection in children from that perspective.
Got it. Right. Dr. Singhal, so, the point about children not being infected in preference to adults. So, and what's your experience from on ground here, particularly through the second wave? And are you able to project onwards?
Yes, so what we have usually seen in the second wave that children have been infected from adults and not the other way around. So usually those children who have been infected have had a family member who was infected. It's not been like the child is the one who's the only one infected and then spreads infection to the parents. So that is what we have seen. And the other thing which we have seen in the second wave is that the case reproduction rate is so high that children have all the family members have got infected. Whereas in the first wave, you would see that only 30 to 40% of the family would get infected. But this is so highly transmissible that all children got infected. And that is why if one would conduct seroprevalence studies now, you would find that, you would have similar rates of infection amongst adults as well as children. Unless, of course, they're like very small children.
Completely agree. Yeah.
Right. Go ahead, Dr.
I said I'll completely agree with you, doctor. We haven't measured that secondary infection in kids, but I can, I'll bet you that what if you did a seroprevalence study, you would find a comparable rate in kids. So yes, the whole issue of getting very excited about the third wave in kids needs to be, I think, toned down a little bit. I think it is getting ahead of us. It is making a lot of people anxious, and I think we have to go with what we know from both abroad, but also from India. Let's look at Indian data as well, and from AIMS as well. It's been repeatedly the same message has come. It's not infecting children in excess. Some of it comes from the sense of fear and the sheer helplessness that we had in the second wave. That we mustn't be caught unawares. We should not be caught unprepared. I think that is a lot of it is driving this fear.
Right.
No,
so,
I
Dr.
just
Singhal, now if we were to, fast forward a little bit, obviously parents are anxious to get children back to schools. Children, in many cases, also want to, I'm sure, get out of the house, if not back into the school. So that obviously creates a new consideration set, so to speak, for the spread of infection and disease or virus. How are you looking at that? And particularly since this could start playing out in coming months.
So one thing which we have learned till now is that when the rates of infection go down, at that time, so much of transmission doesn't happen in school. So we have a time between the second and the third wave. And I think this time should be utilized for some partial opening of schools where children can go in batches because they need that kind of social contact. And then it is possible that when the third wave hits, we again close them down. So we will have some time window between the second and third wave where we can afford to open schools and get children there, because otherwise, if you don't open them now and then you say we'll do everything once it finally goes away, we don't know when that time will come. So we'll have to learn to live with the virus and understand that, because even if you remember the last meeting we had, and I said that the precautions went down in October, November, and the surge came somewhere in February and March. So it was not the opening up or the lack of precautions which drove the second wave. It was actually a new virus which came into the picture. And I think it is some time before that new virus would come. And therefore, I think this is the time where children should be allowed to go to school in batches for maybe 2 hours or so with proper precautions, so that, so that even when the third wave strikes, we'll again have a closure of schools, I guess.
Okay.
Can I just also
Dr. Gupta, your experience, United Kingdom is, of course, now opened up for schools.
Yeah, I think you're absolutely right. One thing that can be done in schools, and the schools are much more organized. It's not like your open bazaar. It's not like open markets. So having kids, learn about social distancing, wearing masks is a lot easier to police, a lot easier to train and learn. So I think in that respect, schools are less chaotic, and I think we should encourage that this reopening of schools for the time period now between the second and third. So the fear of the virus circulating and getting out of control is not happening as much in schools as it is happening in the general community. I mean, you see the pictures from Delhi or my hometown, and people are thronging the markets. I mean, that's far more uncontrolled than a school environment where there is a lot of oversight. So that's one thing I would say. The other thing I would want to highlight also is in the UK, of course, the vaccination strategy is focusing on adults at the moment, but we have got the vaccine approved, the Pfizer vaccine, which is approved for kids. Now, I think the idea is to vaccinate kids as well, but the idea behind that, I reiterate, is not because we are particularly worried about children's health. We are more concerned that the kids are also playing a part in the transmission of the virus. So it is dampening down that part which is there. So it comes back to the original question: how much should we fear illness in kids? I think that is comprehensively answered in the sense that we shouldn't be fearful. It's not that we should be complacent, because there's a small number which will get very unwell, but it then links to resources. And ma'am will agree with me that if you've got a limited pool of resources, would you want to spend that in opening up a lot of pediatric intensive care units? It's a question, it's a political question. But from our perspective, we would say that, would that really be value for money in relation to COVID? Or the national resources are better spent where you get most bang for your buck? And I think...
Got it. Right. So, Dr. Singhal, so again, from a parent would perhaps say that, yes, maybe transmission possibility is relatively less in a school because it is more organized, or most schools would be more organized. But the fear is that if the virus does jump from one child to the other, nothing may happen to the children, but they may bring them back home, in which case, and our vulnerability is in any case is definitely less, even despite the fact that we are vaccinated. And in any case, many of us as a country, including adults, are not going to be vaccinated for many, many months going forward. So where does this equation leave us?
So we should look at what happened. The first and second waves happened without the children going to school, isn't it? So, I mean, the children had no part to play in that. So that means that there are various other places from where adults and elderly people catch infections. So, I mean, now if you have adults and elderly vaccinated, which is happening at a very, very fast pace,
Very rapid.
then we also know that the disease is less severe in vaccinated people, especially if they've received their 2 doses and 2 weeks have elapsed. Then I think we need to give the children a chance as well, to go out and learn, because otherwise we'll see a mental health epidemic in front of us, which is already happening. And also, we have to see, if we are opening the markets, we are opening everything else, then why are we not opening schools? Because as Dr. Amit said, that it is easier to police schools. So I think we cannot stay in a state of lockdown forever, and we don't know how long this whole thing is going to last. So at some point we'll have to cross the bridge, or, and take this decision. Yes.
Okay. I think it's important to say that the end game of this whole business is vaccination and getting the numbers up. So it's a race between us and the virus. Some countries are doing it better than the others. But, what's happening in India is that we are on an accelerated path of vaccination. And it is that judgment that we are constantly making, is how much to lock down, how much to open up. And this will be, as in they say in Hindi, aankh micholi will continue, I think, till a few months, till you get the enough vaccination on board. What we should hope and pray is that there is no new mutant. I think that is where the problem may happen, is if a new mutant comes along and disrupts the pathway, that would be the most disruptive risk.
Right. I'm going to come to vaccination in a moment. So what, if I've got it right, both of you concur that schools in themselves are not necessarily super spreading centers, and therefore, and cannot be any more than what other causes of super spreading or disease virus transmission have been in the previous wave. So therefore, we should allow schools to open up. Have I got that right, Dr. Gupta?
Yeah. I think ideally, ideally schools should not be opened up till everybody is vaccinated. But we are not talking about, we are talking about one bad option versus one less bad option. So we have to choose the lesser of the evils, of the two evils. And the lesser of the two evils is, if you're opening up everywhere else, and you've got a system where 1 year plus has happened, where school kids are sitting at home, and you can monitor them well, you might as well open them now and still continue the vaccination in adults. So that's what I would say, is that's the balance that you might strike between achieving reasonable mental health and managing risk.
Right. And this is, of course, a public health decision, which is also quite political and has been and will be in most countries. So let me come to the point on vaccination. Dr. Singhal, your thoughts on at what age? I know right now we're not vaccinating children in this country, but obviously there's a lot of discussion around that. What would you advocate?
So, unfortunately, we don't have any vaccine approved for kids as so far in India. So, Covaxin trials have started, but it will be some time before that data becomes available. And we don't know whether Pfizer and Moderna will come and when are they going to come. But if the vaccines were to be available, then they should be first given to children who have comorbidities, because those are the group of children who are likely to get severe COVID disease. That is one. And second, I think adolescents, because even amongst people who get healthy people who get severe COVID, adolescents are an important, population. So I would suggest that we first give it to children with comorbidities, then we give it to adolescents, and as data about the safety and efficacy accumulates, then we move down to the lower age groups. And I think that is what is happening all over the world, because even in Canada and in the US, they're right now vaccinating children between the ages of 12 and 15.
Right.
I think, can I just add one more thing? There is a very good ethical argument to make, where countries like the UK, which have got most of the adults vaccinated, I think getting kids vaccinated with the doses is, in terms of public health policy, is still a luxury, because you're not trying to protect disease in those cases as much as you're trying to dampen the virus. So I would say there's a very strong case for many of the Western countries to be giving the Pfizer vaccine doses, if it's approved, to actually vaccinate the adult population, and get the adults vaccinated. And so I've got some sympathy for the idea that instead of many of the Western countries racing to vaccinate their children, it is much better that those vaccines are donated to countries like India, where you are struggling to get the vaccination rates up. So that's a small point that.
Yeah, but I mean, I would like to kind of disagree a little bit, because India still has access to vaccines. I think right now the limitation is not so much as the number of vaccines as the capacity to vaccinate. I mean, we are vaccinating between 2 to 3 million people every day in our country. So I think there are many other countries which have not even the access which India has. And while we may argue ethically, but when you have your children and you are at the head of that state, and if you don't vaccinate your children, and if you send your vaccines outside, you are not going to be very popular, because people would say that they need to look at their home before outside. So unfortunately, it's an unequal world. Yeah.
No, it is. I was just making a point, just a point. I know that it will not happen.
I agree, because WHO has also criticized this. In fact, they're saying that developed countries should be sharing their vaccines instead of vaccinating the kids. But this is how the world is.
Yeah, and if the WHO is saying that you should preferentially send these vaccination to those countries where adult vaccination is not available, that itself reflects on the mildness of the disease in kids. And I think it feeds into the same narrative.
Right. Okay. So let me sum up, or rather get your sum ups, Dr. Gupta. Let me go with you. So the question that I started with was, is there anything to fear from a potential third wave when it comes to children? And if so, what should we be doing? Can I get a sum up answer from you on that, and then Dr. Singhal?
So the third wave is likely to come. There is no evidence that kids will be infected in preference. there is no evidence from the first and second waves that the children have been infected or have died in excess. So I think the anxiety around the third wave and children needs to be toned down. And I think there needs to be an understanding, if you've got limited resources, where would you like to spend your dollars and rupees, and whether you want to set up new PICUs or redirect them. So I think that's what I would say.
Right. Okay. Dr. Singhal?
So I would say the same thing, that there is no evidence that a third wave is going to preferentially affect children more than adults. And children, fortunately, by God's grace, have done well with COVID. However, for India, this is also a time to improve its health infrastructure in all for kids. Because though they may prepare intensive care units and they may expand pediatric beds, the government is also doing it with the mindset that even if, let's say, the third wave wouldn't affect children too much, at least it is going to be something like a legacy for later, because pandemics will come and go, and we may have some which may affect children more. So I think that is also the thinking behind expansion of pediatric units.
Right.
And I
right.
mean, we support that. Yeah.
Yeah, I mean,
Right.
pediatric bed space in India needs to increase. I mean, there's no doubt about it. And PICU needs to go up, irrespective of a pandemic. So I take that point. But specifically with COVID, that's a different story. Yeah.
Right. Oh, right. We've run out of time. Dr. Singhal, Dr. Gupta, thank you very much for joining me and sharing your thoughts. And I do hope to be speaking to you again as we move, but not hopefully progress to the next wave. Thank you so much for joining me.
Thank you. Thank you for having us.